surgeon practicing in the Philadelphia area. I actually grew up in the Philly suburbs, and then my family is in Northern Virginia. I went to William and Mary for undergrad, University of Virginia for medical school, and then went to University of Kansas. So went to the Midwest to do my ear, nose, and throat training, which was 5 years. And then I wanted to specialize further to do facial, plastic, and reconstructive surgery. I did my fellowship in Chicago, and then eventually came back to the East Coast. This is, I think, a great organization. I've worked with a couple similar organizations on Instagram. Just one other plug, if any of you are interested in surgery and journal articles, I'm part of this other Instagram group called Future Surgeons Journal Club, where we do actually Instagram live discussions once a month over articles and have students watch along too.
Yeah, that's how I found you.
Oh, great.
So yeah, I guess you could kind of go through your undergrad, what you kind of majored in, and why you wanted to kind of do plastic surgery, and what made you kind of pick the medical school that you already went to. So kind of like a general background of everything.
Okay, sounds good. So I was always interested in plastic surgery since childhood. I actually had my own reconstructive surgeries. I had a large mole that I was born with on my forehead, so it was potentially cancerous, needed to have it removed, and had a number of reconstructive surgeries actually at CHOP in Philly. And I just learned early on the decisive immediate impact that my surgeon had on me, and that was a big, I think, propelling factor for me wanting to do medicine and particularly be a surgeon, in addition to being interested in science and math. So I ended up going to William & Mary for undergrad. I thought it was a great school in terms of a smaller school, liberal arts. I first majored in neuroscience, again, just really interested in the sciences. And then I had time to do another major. So I actually also majored in international relations, tied both those in for like a global health focus. So I strongly recommend for college, if being on the pre-med track, you have to take a lot of certain courses. So a lot of times it's easy to just major in science, but if you have the time or room, because you only go through college once, to major in something else that you really enjoy, especially if you like the humanities, something non-science. I actually got to go study abroad in England to my junior year. It's pretty tough when you're in the pre-med track, but if you are able to do it, I know COVID times are different, but I think getting an international experience. I also did a couple medical mission trips in college. I highly recommend that because that also helped foster a sense of service for me and help to feel more my passion of why I want to be in medicine and help others. And so living in Virginia, I was lucky. We have really good in-state schools. I did apply broadly to different medical schools as well, both public and private, and just felt fortunate. University of Virginia, I had a great experience there. It was very balanced. They had pass-fail system the first couple years. Students work hard, but also play hard in the sense that they take time for self-care, not necessarily studying all the time. So
All right, thanks so much. So the next question is kind of, how long was your journey to become a plastic surgeon, and what kind of procedures do you do?
So I went straight through. So after undergrad, I had 4 years in medical school, and then 5 years of residency, plus then 1 year of fellowship. So that sounds like a lot, but if you compare it to someone, the minimum residency is 3 years. And if you're someone, say you do medicine or pediatrics, that's 3 years, and you want to specialize, there's at least another 3-year fellowship. So it's pretty similar. So don't be intimidated when it comes to surgery. There are longer tracks out there in terms of how specialized you want to be, but I felt like it didn't take that long. And then now I'm just under a couple years out in practice. In terms of procedures, so with facial plastic surgery, there's actually a good variation, but it's mainly cosmetic and reconstructive procedures of the face. So I'm a face specialist. Right now in private practice, I do more cosmetic. So that includes like rhinoplasty, which is nose surgery to help alter the outer appearance of the nose. It can also be done to help improve the breathing function of the nose. Also, facelift surgery, eyelid surgery. These are surgeries that help someone who's older with aging face who wants to be more rejuvenated, more refreshed. I also perform non-surgical procedures in the office to help with rejuvenation, like Botox, fillers as well. On the reconstructive side, so as a facial plastic surgeon, you can help take care of facial trauma patients. So if they break bones in their face, they have a laceration, you can help with that, help with scar revision. You can also help with cancer reconstruction. So I don't know if some of you have heard of Mohs surgery, where it's a special dermatologist surgeon who takes out a skin cancer, and they take it out in pieces and they look at it in a microscope so you can really get the smallest defect as much as possible. If they don't feel comfortable closing it, then a surgeon like myself can come in and do the reconstruction.
Okay. So the next one is kind of, how does the lifestyle of a surgeon differ from other specialties?
Okay. So, as a surgeon, I would say if you're interested in surgery, kind of like my perspective with medicine in general, I think medicine is a long journey. You have a lot of time, effort, even finances invested. So when you're thinking about wanting to do medicine, and you like another career path just as much as medicine, I say strongly consider that, because it's a very dedicated field. And I say the same for surgery. So when you go through residency training, I was okay. I'm not a morning person, but I was okay with waking up at 5:30, maybe earlier, to round on my patients quickly and be in the OR all day. Could be until 6 p.m., 7 p.m., sometimes later, and then you're taking call as well. So there's, somewhat of a rigor when it comes to surgery training. And then eventually when you go out into practice, it, depending on what surgical specialty you go into, can dictate your, lifestyle. So I was fortunate with ENT. It's one of the more competitive surgical subspecialties, partly because there's a good work-life balance associated with it. You have a good amount of clinic, like 2 to 3 days a week, and then a lot of the surgeries you do, like say the bread and butter is like sinus surgery, tonsils, tubes and tonsils. The patients go home the same day. So unless you're part of an academic program, you have to take call, but really you're not necessarily the sickest patients. Not like a general surgeon, let's say a transplant surgeon who has to in the middle of the night, go get an organ and do a surgery. So with me right now, because a lot of my practice is elective, cosmetic patients, again, my call burden is minimal. I don't actually take call. I just take call for my patients. My patients for surgery or other procedures go home the same day, so I don't have to round in a hospital. I don't work on the weekends. So for me, it's great. It's a big perk, but at the same time, I don't use that as like the biggest motivating factor for why I wanted to be a plastic surgeon.
Okay, that sounds good. So the next one is, how's kind of like the work-life balance, and people are kind of wondering if it's possible to kind of have a family and time for activities like as a surgeon.
Okay, so that's a really good question, because I had a baby and he's officially 6 months now. So I'm navigating through this kind of new chapter in my life. So overall work-life balance, I mean, you'll see medicine, dictates your life. With your family and friends, you a lot of times have to put your patients first. That's just the name of the game. And it helps. I have a husband, even though he's not in medicine, he's very supportive. But it's hard. Like, he understands when I have to put in the hours to finish up patients and notes. It just takes time. Or a patient calls, you have to take the time, or if you're on call, to go see the patient. At the same time, I think it's really important to have balance and self-care. So I always felt fortunate through medical school and residency. I would admit I wasn't like the best studier, and I knew I wasn't the smartest. So I felt like if I put in more study time, it wasn't necessarily going to help out as much as versus, being able to, when I was in residency, take the time to exercise. I really like, live music concerts. I started to appreciate food, going to restaurants. So took advantage of time, like on the weekends or time off to, go out to eat, to cook, go to concerts. I think that's important also to, have your support system, whether it's your, within your residency, like the hospital you work at, and then also your family and friends. This is definitely a great question, especially for females in medicine. I think we face, extra hurdles too, especially when it comes to work-life balance. For me, I felt like, okay, I just had a baby, even though I'm less than 2 years out of practice, but it seems a little late, which is okay. I think it's okay whenever you decide to start a family. We do have the pressures of, worried about age, how soon to have kids. I even more props to those women who've had babies during residency. I can't imagine how much tougher it is. So, a lot of times right now, I feel like, okay, I'm not doing as well at the surgeon role or doing as well as a mom role. It's hard, to juggle. But the nice thing is, especially when we have avenues like social media, Instagram, and if you have a good support system, you feel like, you're not alone. If you, can look at resources and talk to your friends, I still really appreciate being a mom, but it's tough. It's tough at times. But everyone goes through their own journey. So happy to talk more about that if anyone's interested.
Yeah, of course. So another question is, if I get slightly queasy around blood or internal organs now, will that be an issue for like surgery, or can it kind of be trained throughout medical school and stuff?
That's a good question. So I'm not sure on the surgeon side, but I have plenty of, colleagues who say aren't good about needles and blood draws and such, who are doctors. So don't let that deter you. There's definitely other certain professions in medicine. You don't have to be around blood. Like I have a funny story. I have one of my friends from medical school. We practiced drawing blood on each other. He told me right before that he, is not good about it, and he started turning white when I was trying to draw his blood, and that also freaked me out. And I would admit, I'm not even a surgeon, and I'm okay with cutting someone up. I maybe because of that experience, I'm not good at drawing blood. I get a little nervous about it. So I failed. And then when it was turn to draw my blood, he did it fine without any issues. So I do think, make sure I can give more advice, because I did in my first ENT surgery get lightheaded during it, even though I went through my general surgery rotation just fine. You just make sure you get a good breakfast, and that's always key. Try not to be too nervous, because sometimes just if you're not, remembering to breathe and having a lot of sugar in your system are just like medical factors that could make you more prone to, having issues seeing blood and such. And then, just get through your surgery rotation, and then you'll see whether or not you're meant for it.
Okay, so the last question before we kind of open up the chat is, if you don't mind, like if you could kind of elaborate on kind of the gender and discrimination that you might have faced like throughout your medicine journey, and kind of how it shaped you, I guess, to the person you are. So.
Okay. So I would say overall, I'm very lucky that I didn't, face anything that had such a negative impact on me or deter me, or that had a necessary feel like I reported it. I feel like that helps with having a supportive residency program, and a support system in general going through medicine. I can identify with, in terms of as a female, like first of all in residency, especially when you're surgical residency, you're trying to prove yourself too, but sometimes it feels like you need to do extra or have a fine balance compared to your male peers. As a female, I felt like you kind of then get classified into one of two categories, one being too assertive, too aggressive, versus being the pushover. There's no like in between. And for me, where I sometimes struggled with confidence, but that in medicine, where I had that before going into medicine. And then I also would say I'm a people pleaser. So, but at the end of the day, I would rather be more assertive, and to kind of speak my mind and, feel like whatever it is, if it's not right or fair, because I think it's just different as a female surgeon. And but at the same time, like I was told, going into being a facial plastic surgeon, I have to exude confidence, maybe some style, look polished, because I'm dealing with cosmetic patients all the time, who are paying money to do procedures with me. But I have realized being a female surgeon has its advantages as well. So I think it's good to, when you have a challenge, use it to your advantage, that most of my patients are female. So I have this unique role where I can be more relatable, approachable. I can appeal to the feminine side. Even as an Asian female plastic surgeon, I've had Asian patients come to me, which is great, because I think that sometimes we're my male counterpart, even if they have a lot of years on me, sometimes it's just more on the personal side, that there's an advantage there. I do think, even though we're in 2020, sexual harassment, or discrimination is still prevalent, depending on where you are and with how old school certain systems are. If a number of you follow a number of female doctors on Instagram, I'm sure you've heard about this vascular surgery article and the med bikini movement. So, and I did a post about too. So again, I never experienced anything that it, really felt hurtful, but you just feel like whether certain comments, states you that at any point, whether you're in medicine or somewhere else, it just, as a woman, you don't feel comfortable, right? But then you also don't feel comfortable reporting it, and if it's crossing the line, there just shouldn't be a place for anyone to feel, uncomfortable because of their sex, their gender, or their race, like any similar factor like that.
Yeah, that's definitely true. So I opened the chat up so everyone can kind of start leaving their questions there. And Dr. Ho, you can just kind of go and pick whichever ones that you feel you want to kind of address. So I'm going to leave that up to you.
Okay, great. So what made you choose surgery over clinical jobs such as a family doctor, et cetera? So as I mentioned earlier, I think I was biased from my own childhood surgeries, that I really enjoyed surgery, particularly plastic surgery. I then realized too, when you're going through medical school, so you think you pick a field because you really enjoy that scope of medicine, but it's also certain personality traits and attributes that you have that may go well with a certain specialty. So for me, I enjoy working with my hands. I love being meticulous, having attention to detail. I love the intricate anatomy of head and neck. So I think that really goes well with someone who's, plastic surgeon. Same time, like when I rotate on my medicine and pediatric rotations, I see surgeons as doers, whereas like more of the medicine pediatric doctors are like thinkers. So for me, it was a little bit tougher to, see patients and then you come up with a list of like 10 different problems. You round on patients for hours, you really talk about them. That's just not my skill set and not what I'm as good at, that I realize. So, okay. That's good. Do you mind sharing the salary of a plastic surgeon? So it really varies. I would say, with depends if you're in your own practice or with an academic specialty. If there's a range, like starting with ENT, the average, could be about 300,000. So maybe starting 200,000, for surgery and particularly plastics. But of course, for plastics, say if you're that big surgeon on Park Avenue in New York, you could be making millions of dollars. So it really varies. Would you recommend a guaranteed admission program for medical school? I think those opportunities are great for those who are, dead set on medical school, in a way to give some reassurance if you're interested. I did apply to one when I was in high school. It was Baylor, which I think they had a spot for you. So I think that's a good option, as long as it's not like, you have an out just in case. I think those programs are reasonable to apply to, but at the same time, you want to make sure, like when you apply for those programs, you're in high school, right? A lot of things can change, going through college. As I mentioned before, I think it's important if you have the time or opportunity in college to really explore whether it's extracurricular interests, another major. That's the time to be well-rounded, because otherwise medicine is such a narrow track. There's also those programs that are like 6 or 7 years. Again, I think it's good to talk to someone who's been through it. For me, it sounds really intense. I think the trend more is to take time off. And I saw my classmates in medical school who did, I think were even more mature students than me in terms of being dedicated to studying and doing well in medical school. Medicine is a long journey. You only go through, high school, college once. And I realized even through a time who I was starting med school and who I was at the end of med school, very different person. So it's a lot of time where you find yourself. So, unless you're gung-ho and you have another reason that you want to speed things up, you have plenty of time. But yeah, I think it's reasonable, and talk to those who've been through that process. Being a plastic surgeon has a certain stigma in the community. How has that impacted you and your life outside of work? So that's an interesting question. So yes, I'm more, in cosmetics. I would say if there was backlash that I've had, or in terms of maybe how superficial the work I do, it's maybe been more occasionally on Instagram, where you have the trolls anyways who says, why would someone want to get that work? I think and that's a good question. That's a controversial issue where I have learned too, like I myself, if I'm doing this work, I shouldn't judge my patients for wanting to look or feel better. I do pride on, though, creating and natural results, so not trying to make the biggest lips, for instance. So if my goals and the patient's goals align together, then we can create good results. But at the same time, I think for me, and I think things are changing with social media, younger people more interested in what they can do for preventative care, more interested in plastic surgery work, that it's changing in a good way, that there's less of a stigma, and that it's okay for people wanting to look better, feel more confident. And my goal is to help empower those patients in that way, especially female patients. Were there any other specialties you were interested in? And if yes, what made you choose plastics over them? So I would say when going into medical school, I knew was more interested in general plastic surgery, like body plastic surgery. So you first do general surgery residency as part of your training, and then do plastic surgery. And it wasn't until I rotated on ENT, ear, nose, and throat, versus plastic surgery, that I realized I clicked more with the personalities for ENT. I really like the head and neck anatomy, like being more of that head and neck specialist, versus learning surgery for the entire body. And I knew that there was an avenue to facial plastic surgery through ENT. So I ended up choosing that. Otherwise, it's interesting. I would say there were specialties that actually surprised me, that I enjoyed them. Not to the extent where I would have said I would have switched over, or that I was strongly considering them. But for instance, I really liked my psychiatry rotation. You're never going to have that kind of experience again. You see, acutely sick patients in the ER, and triaging them and talking to them, being part of their care. I was surprised how much I liked OB-GYN too. Not super excited about delivering babies, but I like the surgical aspect of OB-GYN. And I always wonder what would have been my backup specialty if I didn't match into ENT. Still not sure. It might have been anesthesia, might have been a GYN specialty. With all the new non-invasive procedures like non-invasive rhinoplasty, how do you keep up with everything, and do you prefer non-invasive or invasive surgery? Also, which procedure would you say is your favorite? This is a great question. So in terms of keeping up, I think as professionals in medicine, we always need to be learning. So that includes, going to meetings. I'm part of certain societies like the American Academy of Facial Plastics. That way I could, myself present on, procedures or things I'm doing, and also learn from the biggest names in the field of their innovative techniques. Also reading up on journal articles. That's key too, to be up to date on the literature. And then even on social media, on Instagram, I think it's a way to educate yourself to see what other surgeons or injectors are out there doing, but also, taking that with a grain of salt. And I say that to you guys too. I know you follow a lot of professionals in medicine, but just make sure that they're well researched. If they're presenting information or trying to educate, I think that's important because there is a lot of misinformation out there. And then which procedure? So I actually really like rhinoplasty a lot. It's one of the toughest procedures in facial plastic surgery. Just like with other procedures of face, a millimeter change can make a big difference. But I like how there's a mathematical basis to it in terms of what we think in terms of proportion and balance, and how the nose corresponds with the rest of the face. But there's also an artistic element to it. It's a really hard surgery, but if you get good at your craft, it's really enjoyable. I just saw like a rhinoplasty patient of mine yesterday who's 2 weeks out, and he's looking better and better. It kind of surprised me how good he looked yesterday too. So would you say a surgical especially allows for research time as well? Yes. And in order to be able to get into a surgical specialty, like match into it, you will need to pursue research and have that on your CV, like projects and possible publications and presentations. I feel like surgical subspecialties are increasingly more competitive, or increasingly competitive. So, and then during residency, depending on the kind of program you have, you'll have research rotations, or you just have to, on your time outside of your clinical work, work on research. So for me, we had research rotation my third year, 3 months, and then my fourth year, 2 months, which was a nice time to do research. Was managing relationships such as friendships, family during medical school, residency, etc. So definitely, yes. I think I'm still grateful to have a strong support system. Even though I'm Asian, my parents like to remind me they didn't encourage me to do medicine. And so they don't understand as much kind of the ins and outs, but they've done what they can, to help be there for me. Like in medical school, I was only 2 hours away, so they'd come visit. My mom would, bring food, make me food, or I'd come home from time to time. I would say I actually was in a relationship with one of my classmates in medical school. It was a serious relationship and didn't work out. So that was really tough. Something, I could talk about more at some point, but I think that affected me, in a difficult way too, where, especially for someone like myself, that was my first serious relationship. So when you're dealing with medical school and studying as well, you can have personal things that happen to you, and it can be a big impact. Also related to that, my closest cousin, she was like a sister to me, 9 years older than me. When I was third year in med school, I found out she had stage 4 breast cancer, and she found out just soon after she gave birth to her baby. Before that, I'd never had any close family member with history of cancer. I know some my peers and others, that's their motivation to want to be in medicine. And then she really fought her disease, but then my fourth year in residency, she passed away. So that was just really tough too, because it makes me wonder, what could I have done? Like, should I have spent more opportunities to try some more time with her? Because she also too, I think, didn't wasn't as transparent about like how her disease was going as much as she was very optimistic. We had a trip planned before she passed away. And then residency, it was harder in terms of my family support because I was in Kansas City and you're really isolated. I actually met my husband during intern year, so you can make friends outside the hospital. He's the first person I met outside the hospital. And he actually ended up moving to Seattle during part of it, and we did long distance. I wouldn't wish that on anyone, but at the same time, it was okay because he wasn't around as much during my toughest years of residency, so it worked. But he's always been, even though he's a non-medical professional, he's been always very understanding and supportive of how often my career comes first. And I think that's unique, to find that in a partner who understands. How did you deal with the financial strain that comes with going down a med path? That's a really good question too. Don't let that deter you, but keep that as a strong consideration, especially if you're considering other professions outside of medicine. For me, I was lucky in that I had a scholarship in college. So what my parents saved in terms of going towards college, it went towards medical school, and I went in state. And then I just had a small chunk left over that they took one loan on, and my parents paid for it for me, and then I basically paid them back through residency. And so I don't have, since graduating from residency, I don't have any loans. So I would say I'm probably really unique. So don't listen to my story that much, but otherwise, I think my peers, it's not uncommon to be in, especially after college and medical school, whether it's 100, 200,000 or more dollars in debt. My cousin, he's a lot older than me, who is in medicine too. I think a lot of others, they just take their time paying it off, and it's okay with the interest rates. And there's also certain pathways too, like if you're in academics for long enough, including your training, you can apply for like an assistance or a program where your loans could be forgiven. So okay. When a patient experiences having nasolabial folds, marionette lines between the nose and mouth, how does the elasticity of the section of the skin make the surgical procedure change? Wow. So this is a very high level question. So I appreciate it. It's very pertinent to me. So, nasolabial folds, for those who don't know, they're like these creases right here. So I have them, even though in my 30s, babies have them. So everyone should have them. And then marionette lines are your like creases down here, the corners of the mouth. So basically, for those who don't know, as we age, we lose volume in the face, and then gravity pulls our tissues down, which causes us to have these creases here especially in the lower face. These marionette lines too, you'll see sometimes in older patients because there's a hyperactive muscle, and some patients, they start to have their mouth more turned down, like a frowny kind of mouth. So so how does elasticity of the skin make the surgical procedure change? So basically, when it comes to aging face surgery, these are patients who have a lot of skin elasticity issues. We lose elasticity. So you see that the skin is sagging, it's more redundant, and the jawline doesn't look as defined. Also, you could have sagging neck skin. So the goal of aging face surgery, which is what non-surgical procedures can't do, like fillers, there's tightening procedures, skin tightening procedures, but they only do it to a less significant effect. Only surgery is the one that can redrape and resuspend skin and the deeper soft tissue structures through like a facelift and neck lift. And by pulling things back, then you can help, and there's some of these ligaments that you can help break up and reposition. That's where you can then soften some of these lines here and make someone look more youthful. If that makes sense. Would you consider hospital employment? What aspects of private practice do you consider advantageous, both personal and factual? This is a good question. So hospital employment, kind of goes along the lines with like if you're in an academic center, or in private practice if you're part of a group. So the benefits of hospital employment compared to where I'm at in cosmetics. So it could be considered more financially stable or secure kind of practice, because you might have a guaranteed salary. You work certain hours, you get paid per hour. And then you also, maybe within that system, especially for a plastic surgeon like me, get in-house referrals, patients, you have colleagues, you have this whole system set up. Whereas for me, like I kind of have to hustle more. One day I might only have 5 patients, because it's slow. I may have a busy day with 20 patients. It just depends if patients want to come in to see me. I have to market myself since it's a client-driven practice that I have. So for me, it's much variable whether I'm gonna, if I do this surgery, I can charge this much. If I do this procedure, I charge this much. Also, with the hospital employment, maybe some of the possible downsides. So you don't have as much autonomy. You will probably have to take call. It depends how good or bad your call is, if in terms of frequency, how busy it is. You have to be in a system where you're around more colleagues. So it depends if you get along well with them or not. And they may require you to do things like you have to have this certain set schedule. You maybe have to, be on these committees that they're just as less autonomy, but at the end of the day, you can maybe more leave your job at work versus and separating it from home. Private practice advantages they mentioned, so you can, depending on the call situation, like for me, I don't actually take call now. I used to take ENT call at my previous practice a year ago. It wasn't great because it wasn't paid, and it was 1 in 4, so I take 1 week a month. It wasn't like super busy, but it just ties you down from that aspect. I do like in private practice, just again, more autonomy and freedom in terms of what I want to do, whether it's my schedule or, figuring out my brand, my platform. I have more freedom with that now as an independent contractor. And I have the potential, if I'm successful, that I can make more money. So it's up to me whether, if you're in a hospital system, you have a more, you're a salaried employee, then you will get a certain amount of time off that's protected. And it might be, hard to say, probably not paid time off, but maybe if you're there long enough, it could be paid time off. For me, every day I don't work is a day I don't make money. So I choose, whether I take 2 weeks off or 2 months off, like me being on maternity leave, that was technically time that I didn't take money. So I'm not, or make money. So I'm not going to make as much this year, just from a financial consideration. How would you recommend to get involved in shadowing research, especially during this time? Yeah, that's a really good question. So I think, avenues like Medical Wonders is great. That this is awesome that you guys are doing this. I actually had a student reach out to me for virtual shadowing, from a different state, which is crazy, but, had them watch virtually a couple of times. It was just hard. I think hard for me because if you're going through a computer and then I have mainly cosmetic patients, trying to ask them for permission, each time, it's just hard. I think in general, it just depends where you are, how strict COVID precautions are. But if you can, if you know a local surgeon, medical professional, even if it's the one that you go to, like your former pediatrician, and if they feel comfortable from a COVID standpoint, say, hey, is there any chance can I come in person and watch for a day from a distance, in the room? Or if you know a surgeon and their surgery center is okay with it, I think that's an ideal way. You maybe can just need to wear an N95 mask, but you can watch with a little bit of distance a surgery. I otherwise, anything, from a virtual standpoint, there are, maybe look at other medical professional accounts. Like for me, I occasionally post procedures. It's not necessarily something you could put on a resume or CV, but at least explore for yourself, because I think with social media, we are increasingly using it as an educational platform, amongst us medical providers. So a lot of times I do before and after pictures. I do video clips of procedures. That way it helps educate potential patients. Research, if you have an undergrad, a college near you, or especially like a medical school, sometimes it helps just to blanket email departments, people, or if you know someone who's a medical student or someone who's a resident, people can benefit from free help, especially at this time. So, I had, this is a good example. I had this one pre-med student. She goes to school in Ohio. She lives in the area. She basically contacted the med spa that I worked at and came into interview and said, hey, I'd love to intern for you for the summer. Don't need to be paid. Here's my CV. And she was awesome, to the extent where she was answering our phones, like acting like a front desk member, checking patients in and out. And then for me, she helped assist patients like with procedures, video, film them, and even with patients where it was easier for me to ask, is it okay if she comes in on this consultation and listens? So for her, she's gotten a lot of in-person, time experience. And then now she's going to help me with my social media, which is great. And she can use that to say she, is a marketing intern for this semester, where otherwise she's going back to school virtually. So I think if you have some initiative and you try, like I did 2 summers at NIH, and I basically blanket emailed a bunch of labs until finally someone said, yeah, sure, we'd be interested. So a little perseverance, it goes a long way. I'm interested in trauma and facial surgery, not very interested in the cosmetic side. Could you be a plastic surgeon? Yes. So you can definitely be someone who is mostly or all reconstructive. I would recommend, a lot of times it's an easier setup to have that if you're with a hospital system or an academic. So just amongst facial plastic surgeons alone, I have colleagues, for instance, that are specialists in trauma that do bigger reconstructions, like what we call free flap reconstruction, where you take a piece of tissue, like from your arm or your leg, and then you reconstruct like a huge hole, like in your face from a cancer that was taken out. Or if they have a facial paralysis, you can put, a muscle or reconnect nerves to try to help improve their facial paralysis. So definitely the sky's the limit. There's also some surgeons who do cleft lip, cleft palate reconstruction and craniofacial reconstruction, even though that historically is more body, like general plastic surgeons. So definitely, but I would say you would more likely have a academic career compared to private practice. Why can anesthesia pose a risk for patients who are older, who have pre-existing conditions such as diabetes? How difficult can it be when treating patients who have increased risk in bleeding and take anti-clotting medicine? These are all good questions. So anesthesia, yes. So any patient that I take for to put under general anesthesia to put to sleep for surgery, especially since they're all elective and not medically necessary, I need them to have medical clearance before they do surgery. What that means is I have them see their primary care doctor who does a history and a physical exam and states that they are cleared from their standpoint to undergo anesthesia for surgery. Now, this is something where I'm in my medical training. I learned how to do histories and physicals. I know how to do a general exam, but I'm just so far removed. I don't actively, monitor or treat blood pressure issues, diabetes. So I rely on my medicine, or primary care doctor counterparts to provide, this reassurance for me. If you have patients with certain medical conditions like diabetes who are older, just think they're just not as fit. When you go under anesthesia, you have to make sure that they come out of it okay. If you're someone diabetic and you're going to do surgery on them, they have wound healing factors that make them poor healing candidates. So someone who I want to do a facelift on, I don't like to do facelifts if they have diabetes. I don't really want to do them if they're a smoker because they're prone to healing issues. And then also blood pressure can make them more, or if they're on bleeding if they're on blood thinning medications, can make them more prone to bleeding, which can cause a blood fluid collection like a hematoma seroma and impact their healing as well. So it's also key for me as a surgeon, even if I rely on another provider to clear them for surgery, that I also have to see too, are they safe enough to do the procedure that I'm doing, if that makes sense. How do you go about with plastic surgery conversations? Do you always encourage it, or are there certain things you look for before recommending it in security? It's a good question. So it's a fine balance that I'm myself learning and kind of tailoring my technique. So usually I want to be as approachable as possible because this patient, it's a private discussion. They're trusting their face in me. As you mentioned, they have certain insecurities. So a lot of times I open up and ask, what brings you in today? What areas most bother you, so I can figure out what they're most bothered by, because what they see might be different from what I see. And also too, even if I give them the most perfect result, the best the result that I think looks great, they look at their face all the time. If it's a millimeter off, or if they have other underlying issues like body dysmorphic issues, I'm never going to make them happy. And those are some things that I need to screen beforehand, especially with how realistic their expectations are. Or sometimes it bites me where I realized after the fact that I couldn't have helped them, to begin with. I also then try to make them comfortable by talking to them about my treatment approach, keeping things natural, conservative. I think that goes a long way with patients, and that's what a lot of my patients are looking for. And I talk with them where I say I'm going to do a thorough facial exam and kind of just approach it as objectively as I can. Like as an outsider, say, we're going to focus on the areas you're most bothered by, and I may talk with you about what other areas that could benefit from rejuvenation or procedure. And I talk about also non-surgical versus surgical procedures. Some patients are like, I don't want surgery at all, but they have under eye bags, right? I have to be realistic to say, this is only what Botox and filler can do. And so sometimes too, the hardest thing to do, which I'm learning myself, is to say no, that maybe I can't help you. So that's just my approach. You know, I've kind of fine-tuned it over the time, but I think you can start with an open-ended conversation, give room for discussion and for questions, and just kind of be as approachable as possible. That's been key to the success with achieving results with my patients. How do you deal with patients who have concerns, personal, financial, ethical, about surgery? This is a good question too. Kind of, I'm similar to my last response of it, just trying to be as open-ended as possible and be as approachable, have the patient give that opportunity, hopefully if they feel comfortable with me, to talk about those possible considerations. I do make sure, you know, if I can tell they're a little budget conscientious, to say, what is your budget? You know, and then again, I'm realistic to say, this is what, with that budget, what we can achieve. Sometimes say it's even for Botox, or they don't want to do that much, you know, and maybe it's not even a budget issue. That I say, I would rather focus on these couple treatment areas than just spread it around too much with underdosing or undertreating, you know, too many areas. You know, if they're really not ready for surgery, then they're not. You know, I just, again, some patients, I just have to kind of gently put it in their head, say, you know, when you're ready, we'll talk about surgery, or we'll say, like, and just remember, surgery can do this, they can get this better result. And as long as the patient is aware of that and understands and is willing to still invest and try something else, you know, that's also a reasonable thing to do. Realistic expectations are key. Have you ever had, oh, sorry.
Yeah, sorry. So we're getting to the time there, so I'm just gonna pick one last question for you to kind of
Okay.
answer. So what is one case you had that changed the way you and the way you view medicine? And is a career in plastics face less, I don't know what the second question is saying, but I guess you can answer the first one.
What is one case that changed you in the way you view medicine? Huh. That's a really good question. So I'm going to mention, let's see here. What is one case that's like changed me in how I view medicine? So I'm going to mention this one case that really, you know, made me seal the deal for facial plastic surgery as a medical student. So it was a paramedian forehead flap reconstruction. So, and it was actually in a 16-year-old male. So he developed skin cancer. So skin cancer, you know, has no age limitations. And so he had skin cancer that had to be removed here. And a lot of times we have a defect here. So ultimately what he needed was a reconstructive of a hole here. And so the best tissue to take is actually, you know, harder to take over here, but you can actually take tissue from the forehead. So you create a flap and you flip it down and it covers the hole. You could look it up, paramedian forehead flap. And then because it has a blood supply, you need to establish this blood supply. If you cut it off right away in the first surgery, then this piece of tissue won't survive on its own. So you flip it down, you have this land bridge, and it sits here for like 3 weeks, developing a local blood supply. And in the second surgery, you cut it down and then you trim the flap, and the results are great. I think that really, you know, gave me a perspective of what the really cool things we can do on the reconstructive side, and also gave me some insight. So to me, on the reconstructive side, sometimes it's easier where, you know, the patients they're so concerned about their facial appearance and scars, but they're super grateful for the reconstructive results. And to me, that goes a long way in terms of my own satisfaction as a surgeon. I do on the cosmetic side too. I really enjoy whatever procedure I do. If a patient comes in with a smile on their face, they look better and they feel better, I think that goes a long way. And I think that's something to take in consideration against the stigma of what some of the negative things that are seen with plastic surgery.
Okay, thank you so much again for kind of coming on and spending an hour with us. I'm sure we all learned a lot. So if you can kind of put your contact info in the description, in the chat itself, like whether it's
Okay.
your Instagram or email, so people can
Okay.
further reach out. And I'm just gonna do the polling thing again, like I did last time. This is just to launch the poll and see how the meeting went and the smoothness of the call, so I have a better idea of what I need to work on for the rest of today's call and tomorrow's. And make sure you guys stay tuned back. I'm going to be releasing another link for the 7 p.m. call with Dr. Shah. So just wait for that. And then tomorrow we actually have a PA taking over, a pre-PA actually, that's in PA school. So stay tuned for that. But otherwise, you guys are free to leave. Thank you so much. And thank you, Dr. Ho, for kind of coming on as well. And make sure you guys check out our Instagram for more extra posts and stuff like that.
Yeah, thank you so much, Sonia and Medical Wonders. Again, feel free to follow me and ask more questions at DrTinaho, Dr. Tina Ho.
Yep. All right. Thank you. Bye.
Okay, take care.
Take care.